Hi everyone, I'm Jin Su. Happy to see you again. In the previous session, we learned assessing in the nursing process. In this session, I will explain the next phase of nursing process, diagnosing. In this phase, nurses use critical thinking skills to interpret assessment data and identify patients' stress and problems. By the end of the session, you will be able to describe what a nursing diagnosis is, differentiate the different types of nursing diagnosis, describe the steps of the nursing diagnostic process. So, what is the nursing diagnosis? A nursing diagnosis is a clinical judgment concerning human response to health conditions or vulnerability to that response by an individual, family, group, or community. It is developed based on assessment data. Nursing diagnosis is a clinical judgment, but another important purpose is to provide a common language and formal basis for communication and understanding between nursing professionals and the healthcare team. NANDA International, earlier known as the North American Nursing Diagnosis Association, is the principal organization for defining, distribution, and integration of standardized nursing diagnosis worldwide. In 2002, NANDA became NANDA International in response to its significant growth in membership outside of North America. Until 2020, NANDA International has approved 244 diagnoses for clinical use, testing, and refinement. You may be confused about what the differences between nursing diagnosis and medical diagnosis. Medical diagnosis refer to disease processes, specific pathophysiologic responses. In contrast, nursing diagnosis describe the human response, a patient's physical, social-cultural, psychological, and spiritual responses to an illness or a health problem. For example, pneumonia, a medical diagnosis, is an infection in one or both lungs caused by bacteria, viruses, or fungi. Hyperthermia is the patient's physical response to pneumonia, which is a nursing diagnosis and defined as body temperature elevated above normal range. The four types of NANDA nursing diagnosis are actual, which is problem-focused, risk, health promotion, and syndrome. A problem-focused diagnosis is a patient problem that is present at the time of nursing assessment. These diagnoses are based on the presence of associated signs and symptoms. A problem-focused diagnosis has three components. First, nursing diagnosis. Second, related factors. And third, defining characteristics. Here's one example of actual nursing diagnosis. Activity intolerance related to imbalance between oxygen supply and demand, as evidenced by exertional discomfort or dyspnea. The second type of nursing diagnosis is called risk nursing diagnosis. These are clinical judgments that a problem doesn't exist, but the presence of risk factors indicates that a problem is likely to develop unless nurses intervene. For example, an elderly client with diabetes and vertigo has difficulty walking and refuses to ask for assistance during ambulation. This may be appropriately diagnosed as risk for injury. Components of a risk nursing diagnosis include, first, risk diagnostic label, and second, risk factors. For example, risk for falls related to muscle weakness. Health promotion diagnosis is a clinical judgment about motivation and desire to increase well-being. Components of a health promotion diagnosis generally include only the diagnostic label or a one-part statement. Please see this example. Readiness for enhanced family coping. A syndrome diagnosis is a clinical judgment concerning with a cluster of problem or risk nursing diagnoses that are predicted to present because of a certain situation or event. They're also written as a one-part statement. Examples of a syndrome nursing diagnosis is chronic pain syndrome. A nursing diagnosis has typically three components. First, the problem and its definition. Second, the etiology. And third, the defining characteristics. The problem statement or diagnostic label describes the client's health problem or response for which nursing therapy is given. The etiology component of a nursing diagnosis identifies one or more probable causes of the health problem. For example, the probable causes of activity intolerance include generalized weakness, sedentary lifestyle, and so on. The third component of a nursing diagnosis is defining characteristics. For actual nursing diagnosis, the defining characteristics are the patient's signs and symptoms. For risk nursing diagnosis, no subjective and objective signs are present. Thus, the factors causing the patient to be more vulnerable to the problem form the etiology of a risk nursing diagnosis. Defining characteristics are written following the phrase as evidenced by or as manifested by in the diagnostic statement. Now, let me explain how to determine a nursing diagnosis. There are three steps of diagnostic process. First, data analysis. Second, identification of the patient's health problems, health risks, and stress. And third, formulation of diagnostic statements. Analysis of data involves comparing patient data against standards, clustering the cues, and identifying gaps and inconsistencies. For example, a child is 17 months old. The parents state the child has not yet attempted to speak. You may think about the developmental delay because you know developmental stages and children usually speak their first word by 10 to 12 months of age. Identifying health problems, risks, and stress. In this decision-making step, after data analysis, the nurse, together with the patient, identify problems that support tentative, actual risk, and possible diagnosis. Also at this stage, the nurse and the patient identify the patient's stress, resources, and abilities to cope. Formulation of diagnostic statement is the last step of the diagnostic process, wherein the nurse creates diagnostic statements. Diagnostic statements can be one-part, two-part, or three-part statements. Health promotion nursing diagnoses are usually written as one-part statements because related factors are always the same, which is motivated to achieve a higher level of wellness. The example of one-part nursing diagnosis statement is readiness for enhanced coping. Risk nursing diagnoses have two-part statements. The first part is the diagnostic label, and the second is the validation for a risk nursing diagnosis or the presence of risk factors. For example, risk for falls related to muscle weakness. An actual or problem-focused nursing diagnosis have three-part statements. It's also called the PES format, which includes the problem, etiology, and symptoms. Please see this example. Impaired physical mobility related to decreased muscle control as evidenced by inability to control lower extremities. Okay, do you remember the case of Mrs. Lin in the previous session? After studying this session, can you write the nursing diagnosis for Mrs. Lin? Thank you for your attention. See you next time.